Wonderful. We have over 120 participants. Good afternoon. I'm Hal Baker, Senior Vice President and Chief Information Officer for WellSpan Health. I'm also an internal medicine physician and have been actively involved in incident command over the last several weeks. Thank you for joining us for this community webinar. From the highest level of our organization, the WellSpan Board of Directors, the WellSpan's President and CEO, Roxana Gapster, and our entire executive team, today's updates are in a continuation of our previous webinars and conference calls with all of you to maintain open lines of communication as we respond together as a community to COVID-19. Our CEO, Roxana Gapster, initiated a series of individual briefings in March, and this webinar series continues that conversation with regular topics of interest to those of you tuning in. We value each of you, our community leaders, local employers, volunteers, donors, and friends of the organization for taking time to join us today. Today we'll be sharing updates on a few topics and we'll leave time for some questions. Many of you have submitted topics when you registered, so we'll answer those and also have a live Q&A. We'll begin the updates regarding the COVID-19 response with a discussion on some of the data and some of the information we've collected. We'll then hear from Dr. Mark Godek, our Vice President and Regional Medical Director, about our preparation and what's happening across our region for employees and groups returning to work in other settings. Lastly, Dr. Mike Diller will speak about the mental health and the ways we can all lead with resiliency through this time of crisis and challenge. I think you'll hear in our comments today that while we are seeing good news about the flattening of the curve, it's so important to remain vigilant in the coming weeks and months. As a community, we'll move through new decisions and new phases of resuming new day-to-day routines. This will require all of us to maintain a high level of safety and cooperation to continue to protect ourselves and others. And then we'll wrap up with Q&A. And thank you to all of you who have submitted questions when you registered. If you have questions throughout the session, please use the Q&A function to submit them. We may not get to all of the questions today, but we will do our best to respond directly or provide more details during future updates. Before beginning with our first speaker, which is actually going to be me, I want to acknowledge the unwavering perseverance of our frontline heroes within WellSpan and throughout the community. Our skilled nursing facility colleagues, first responders, community groups serving the vulnerable populations, and so many others. We are truly grateful for their dedication and compassion as we all work together to fight COVID-19 for you and with you, from me and for all. And on behalf of WellSpan, I would also like to thank our donors for their support of supplies, funding, food, and talent, and appreciation. Again, thank you so much for all you do within our community and for joining us today. So first, let me say that I couldn't be more impressed also with how we're all pulling together and to support one another across WellSpan and central Pennsylvania. This has been an exceptionally challenging time in and outside of WellSpan in our communities, and people really are truly rising to the challenge. And we'll talk about some of the data that shows that. Today, I'll share with you a few updates on WellSpan's response to COVID-19. We do continue to be in regular communication with the Pennsylvania Department of Health to ensure we're following the most current guidelines from them and the U.S. Centers for Disease Control and Prevention. We are really seeing some good news nationally and locally that the social distancing efforts we've all put in have slowed the spread of the COVID-19 virus. We encourage anyone who believes that they may need to be tested for COVID-19 to contact us first so you can be screened from home before coming in for testing. This can be done either via the internet or by phone. For instance, you can go to wellspan.org and use our coronavirus assessment tool to determine if testing or follow-up may be necessary. More than 17,000 people have used this tool to date. We also offer a toll-free hotline. That phone number is 855-851-3641, and it's available on our website also. It's important that anyone who needs testing first be assessed through the phone or the web or by their primary care provider before proceeding to our testing areas. We recently developed an online platform that provides local data about our COVID-19 testing and patient care results. It's located at wellspan.org/coronavirus. It's also important to rely upon the Pennsylvania Department of Health if you want more comprehensive regional data or statewide data. We share our testing results with them daily, and they are our trusted source for accurate statewide information. Their website is health.pa.gov. Our COVID-19 Information Dashboard provides daily updates regarding testing and patient cases across our health system and within each of our counties that we serve. It's our hope that the data will reinforce the need of our entire community to remain vigilant and to continue the efforts we've done to slow the spread of this disease, especially as we try to start to return to work and more normal lives. As you'll see, we have completed more than 18,000 tests for COVID-19 since mid-March. About 1,800 of those have come back positive for the virus, and that's about 10%. The overwhelming majority of those patients are recovering at home, and a small percentage, fewer than 200 individuals, have been treated or are being treated in our hospitals. Many have asked about test availability and supplies. Currently, we have over 14,000 swabs to do testing and think that we have an adequate supply for the near future and beyond. Regarding hospitalized patients, the number of positive cases in our 8 WellSpan hospitals is 47 as of an hour ago, with 14 in intensive care. This represents only 5% of our inpatient capacity, meaning our system is clearly not overwhelmed. And that's good, and that took all of your cooperation. Our response plans include the ability to move resources to where they are needed within our system. As we look to the future, we remain prepared to respond to increases if they occur. Focused educational efforts are underway, not only by WellSpan, but also on a national level to address the groups that are most vulnerable to contracting this virus. The most critically ill COVID-19 patients at WellSpan hospitals may qualify for an investigational treatment protocol using convalescent plasma to transfer antibodies from people that have had the disease to people who have it. As part of the FDA's expanded access program through the Mayo Clinic, WellSpan physicians have started to offer this new treatment to COVID-19 patients. And we've used this treatment for some of the sickest COVID-19 patients at WellSpan Good Samaritan Hospital, WellSpan Ephrata Community Hospital, WellSpan Chambersburg Hospital, and WellSpan York Hospital. Only those who are critically ill and hospitalized qualify for this convalescent plasma treatment, but to date, more than 30 patients have received this treatment. Those of our community who have recovered from a confirmed case of coronavirus and have been symptom-free for 28 days are eligible to possibly donate plasma to help others. Information on how to donate can be found at wellspan.org, and I can think of no higher gift you can give. The good news is that our region has not been hit as hard as other areas in Pennsylvania, such as Philadelphia or Montgomery County. However, based upon the forecasting models we've worked on collaboratively with the University of Pennsylvania to develop, a bump in cases in the future is certainly possible, and we are particularly watching with concern for this coming winter with the annual flu season. That means our region is still characterized as being a place of active community spread. So please don't let your guards down just yet. As we look to return to work and reestablish pre-COVID-19 social interactions as best we can, it's wise to consider that this data showcases a limited spread of this disease brought on by aggressive social distancing efforts. It remains unknown how these figures would have looked without taking those precautions, but we are confident that the work of our communities made a difference. As an organization, WellSpan is continuing to provide care in safe ways and practicing social distancing where possible. By leveraging technology, we've accelerated many of our telehealth offerings to transform the way we connect with patients and consumers. Before COVID-19, we were offering online urgent care, video visits, and other ways of connecting with patients that didn't require an office visit. And we now have video and phone visits across all of our medical group and behavioral health practices. And they are now accounting for almost 50% of all of our visits. We have also started video consults for physical therapy and appropriate inpatient needs within our hospitals. The ages of our video patients has ranged from 4 days old to 98 years young. In all, we have provided more than 35,000 video visits between mid-March to mid-April. Compare that to the 4 weeks before, where we only did about 50 in the month before. To put this in perspective, in 2019, we did about 2,000 video visits. In the month of April and May, we're averaging 2,000 video visits per weekday. We know many of you are making changes to how you run your businesses and organizations. This is just one example of how we're doing the same. It's certainly a time for innovation and new possibilities that will serve our communities well beyond the pandemic. Again, thank you for all you're doing to support our friends and neighbors. Now I'm going to turn it over to Mark Godecker, who will discuss preparation for returning to work.
Thank you, Hal. Once again, as Hal mentioned, my name is Dr. Mark Godecker. I'm a practicing family physician in the York area and Vice President and Regional Medical Director with the WellSpan Medical Group. Our community has really done a remarkable job over the past few weeks to pull together and ensure those who need care can continue to access it. Today, I'd like to share considerations to protect the health and safety of employees returning to work. Some employers on the call have remained operational, and we are grateful for their necessary life-sustaining contribution, while other employers are now in the process of reopening and returning staff to work. We understand the stress and hardships that temporary business closures have created. For this reason, we realize that WellSpan's in a unique position to help. As a healthcare system and a provider of employer services, we want to share timely insights and learnings so your businesses may consider policies and procedures to protect the health and safety of valued staff members. As employers and residents, we turn to the Pennsylvania Department of Health and the Centers for Disease Control as the source of truth for news, information, guidance, and mandates to ensure the safety of our families, friends, and communities. Like you, WellSpan looks to these organizations as the subject matter experts. We are grateful for their cooperation in advising our teams and our internal subject matter experts to help WellSpan align our policies and procedures with their guidance. I know there are a lot of questions and conflicting data about how to keep employees safe and what employers should be considering going forward as businesses get back online. Excellent guidance exists from the CDC and our state and local officials. However, I understand that business leaders are struggling with how to translate that into action plans for their businesses that are in compliance. Today, we will try to help share ways to incorporate a new set of norms and requirements into your businesses. First, it's important to continue implementing mitigation strategies until and probably after there is a safe and proven FDA-approved vaccine. As employees return to the workforce with new safety precautions and fear of the unknown abound, instilling confidence that it is safe to be on the job can be accomplished through communications and actions. Make certain you inform staff of safety measures that are being taken. Here's what the CDC and the State Department of Health has suggested. Employees who have tested positive for COVID, who have been in contact with someone who is positive for COVID, should self-isolate and follow the return to work algorithms provided on the Pennsylvania Department of Health website. A COVID positive employee will not be able to return to work for at least 10 days with no fever for 3 days and improvement of symptoms. Those employees who are exposed to COVID positive employee in close contact will need to self-isolate for 14 days. Those companies who are considered essential or critical infrastructure may initiate pre-shift temperature screening as part of the return to work process without isolation. There'll be more to come on this in a moment. Importantly, employers should refrain from requiring returning employees to obtain work excuses from their medical providers. These are not a requirement nor recommended by the Department of Labor or OSHA. The reality is that one COVID positive staff member may lead to multiple other exposed employees. The same precautions must be taken with all. Furthermore, facilities where these employees work must undergo thorough sanitizing. For guidance regarding the disinfection process and other requirements for employer, please refer to the April 6th order directing building safety measures from the Secretary of the Pennsylvania Department of Health. Another resource just posted to the CDC's website specifically addresses reopening guidance for cleaning and disinfecting public spaces, workplaces, businesses, schools, and homes. There is no doubt that a COVID-positive staff member can cause significant service disruption in an organization. And to no surprise, we're hearing reports of employees who are refraining from self-reporting due to fear of losing their jobs. As leaders, it is important to provide staff with the reassurance that they will not lose their jobs. Staff need to feel supported to do the right thing. If they don't, they threaten not only the livelihood of the organization, but also those around them. Beyond staying home when feeling sick, the best preemptive measure is to reinforce social distancing with your teams. You'll need to redesign workspaces to avoid crowding, stagger shifts, wear masks, and sanitize all workspaces and common areas often. Infectious diseases are spread through contact. Removing the contact, and you mitigate the chance of contacting the disease. Listen to the hygiene rules that your mother taught you when you were a kid. Wash your hands, practice respiratory etiquette by covering your cough and your sneeze. In addition, respect social distancing guidelines whenever possible. In situations where social distancing is not possible, protect yourself and others by wearing a cloth mask. For non-clinical use, fabric masks are generally adequate. WellSpan has sewing instructions for creating masks posted on wellspan.org. For businesses, consider what your sanitizing protocol will be. How often will you clean? Who will provide the service? How will they be protected? What products will be used? It is recommended that you use sanitizers of at least 60% alcohol. Follow the manufacturer's guideline for the time to be left on the surface for maximum benefit. Staff screening is a preemptive way of identifying potential COVID-19 positive cases. This can be as simple as reviewing a checklist of symptoms: fever, cough, shortness of breath, and administering a temperature check prior to the start of each shift. As always, require that employees stay at home if they are sick. And I'm going to emphasize that again. If employees are sick, we want them to stay at home. Operationally, you will want to establish guidelines for on-site meeting participation to ensure social distancing that can be maintained. The size of your conference rooms may dictate the appropriate group maximums. Post signage in high-traffic areas that reinforces the key points of social distancing, which includes maintaining a 6-foot distance between people. WellSpan also has Fight COVID-19 posters available in English and Spanish. And if you would like these, submit requests for these posters to wellatwork@wellspan.org. Make certain expectations known to staff at every opportunity, such as wear masks, cover coughs, wash your hands often, maintain social distancing, and the importance of sanitizing workspace. Create ways to enforce these protocols and be especially clear, stressing the importance of staying at home when sick. The community has been proactive and really wants to do the right thing. Employers have been asking great questions to identify the best ways to keep their people safe. WellSpan Occupational Health continues our core services such as pre-employment physicals, Department of Health CDL driver's exams, Department of Transportation, work-related injury and illness care, as well as DOT and non-DOT drug testing. Additionally, we can provide employers with training on pre-shift temperature screening, educational resources for the workforce. One frequent question that we have received is the availability of on-site screening and testing for employees. So let's talk about the 3 different types of screening and testing available for COVID-19. First off, there's temperature screening of employees. This is easily performed and widely recommended. Having a fever is one of the main symptoms associated with the coronavirus. A digital forehead thermometer is safe and easy to administer at the beginning of each shift. Next is the COVID-19 RNA PCR testing. This is a test done to see if a patient has the coronavirus or COVID-19. It is performed by inserting a special type of cotton swab into the patient's nose all the way back to the nasopharynx. This is the area in the back of the nose and the throat. It is recommended that this test be performed on patients who have symptoms of COVID-19. One of the limitations of this test is it can remain positive for up to 6 weeks, long after the patient's symptoms have resolved and when they are no longer infectious to other people. Lastly, there is antibody testing, which you may have heard about in the news for COVID-19. This is performed by obtaining a blood sample. Antibody testing is not recommended at this time, as it may detect other previous coronavirus infections that a patient had, not just COVID-19. We call these false positive tests. Let me repeat, antibody testing is not recommended, and WellSpan is not using antibody testing for employees. I want to stress how important it is to direct someone suspected of having COVID-19 to call their primary care provider or the WellSpan Coronavirus Information Hotline. That will ensure that they get to the right care at the right place at the right time. It could save their life. We've also heard from patients experiencing serious medical conditions not related to COVID-19 who are choosing not to come to the hospital over fear of contracting COVID. I want to reassure everyone that our hospitals and emergency departments remain safe places to seek care for emergency conditions. Do not delay care for these conditions. Call 911 or go to the nearest emergency department immediately if you have a life-threatening condition. To protect patients, WellSpan has taken the following measures within our hospital. We have dedicated COVID-19 patient care areas. Patients who have tested positive or those that are showing symptoms of COVID-19 are isolated to specific treatment areas. Those patients are treated by a care team assigned to only COVID-19 patients. We have limited entry points at the hospitals, at all of our hospitals. All staff, patients, and visitors will enter the hospital at designated entry points where they will be screened prior to entering. Staff who screen positive are evaluated by our employee health department before they can return to work. We have implemented visitor restrictions. By limiting visitation to specific types of patients, we can maintain social distancing and help prevent exposure to COVID-19. All staff members working on COVID-19 patient care areas, screening areas, and emergency departments are required to wear personal protective equipment, or PPE, including masks, gloves, gowns, and eye protection. Our staff is trained in the proper use of PPE. All hospital staff are now required to wear the appropriate mask during their shift, and our patients are also encouraged to wear face coverings to prevent any spread within our hospitals. Please keep your health and safety of top of mind, and know we are here to provide you with the very best and safest care. And now I'll turn it over to Dr. Mike Diller. Mike?
Hi, everyone. Thanks, Dr. Godecker. Appreciate your time and sharing of your expertise and wisdom here. Hello, everyone. My name is Mike Diller. I'm a licensed psychologist and the director of WellSpan Employee Assistance Program. I want to appreciate you making the time to share some time with us today. The COVID-19 pandemic continues to unfold and change in ways that create uncertainty. Without a historical reference or a definitive endpoint, heightened stress is sure to follow. Prior natural disasters such as 9/11, Hurricane Katrina had a definitive end and a start to the recovery. This is different. We're at a point now where we need to maintain all the social distancing and other preventative safety measures and find a way to begin to resume all of the daily routines we've longed for, such as going back to work and reopening of businesses and other types of commerce. There have been many losses during this time and since the start of the crisis. Loss of a loved one, loss of the way of life prior to the pandemic, loss of connection, losses involving financial, food, and housing security, and a sense of loss of control and a loss of safety. This is stressful. And as we really have no reference point. We've never really had to deal with this before. So what can we do? What can we do to help support your team members during this time of transition and ongoing uncertainty? Here are the keys to remember. People do much better with routine, structure, and predictability. We know this. The more that you can provide that clear initial update as you're bringing people back together to work, as much factual information, the better for everyone. Things like, this is the current state. This is what we're doing to help keep everyone safe, following and we're complying with all of the CDC and Pennsylvania Department of Health guidelines. This is the schedule. This is the process. This is who to contact and how to contact that person in the department with any questions. Regular follow-up and communication, regular follow-ups regarding updates, changes in processes, and then also providing a way for team members to be able to share or offer ideas, those that are in the mix, and then with their leaders. But it's also helpful to provide them with supportive resources, such as information about their employee assistance program, wellness program, or other types of support that you might be able to offer to make them aware of that and to let them know how to access that. Stay connected. This is hugely important. Huddles can work, but not all businesses and organizations are able to do that. So this is the key to remember, making sure that leaders, we all are checking in with one another, check and connect, ask simple questions. Sometimes it's the simplest question that can make all the difference in the world. How are you doing? What do you need? What would be helpful to help you right now in doing the work you need to do? You don't have to have all the answers. Your caring presence, your support, that's what matters. But it all really starts with you. You need to take care of yourself. So take care of you first. Mindset matters. So in psychology, we have this concept called the wise mind. So the wise mind is kind of the blending of the emotional mind and the rational mind centered. When we're able to aspire and hold on to that wise mind, we just do much better. We think clearer, more effective, more efficient. This is what happens. When we're under stress and extended periods of stress, we get a little off balance, a little off kilter, and we may struggle and maybe move into more of that emotional mind. And we may find ourselves not in the best place and not our best selves. It's important to remember this because that's true for us as leaders, you as leaders, just us as human beings and people. So it's true for those that you're bringing back. It can leave us open to understanding that everyone may have some of their own story and some of their own stressors and be more empathic and compassionate to the needs of our fellow coworkers and employees coming back. But it really starts with the more that you take care of yourself, the better you'll be to be able to stay centered and more locked into that wise mind. So they're going to be looking to you as leaders for that reassurance and guidance. And the more that you take care of yourself, the better off everyone is. And for you and for all of us to be able to provide that guidance and reassurance that we're going to get through this together. I want to share something with you from David Kessler. Some of you may know him. He is the world's foremost expert in grief and loss. He shared, he's doing a lot of national talks right now, shared this parable. It's called the Parable of the Long Spoons. I'm going to share this with you now. The Parable of the Long Spoons. So a man enters into a dining hall, looks over the room and sees this long table with beautiful linens and serving dishes, beautiful serving dishes in china, with the most unbelievable food in every serving dish. In these serving dishes, there was an exceptionally long spoon from each one. He looked around the room is full of people, but the people are despondent, depressed, gaunt, lifeless. They couldn't feed themselves. The spoons were too long. This was described as hell. The man is then escorted and entered into another dining hall, much the same as the first one. The long table, the beautiful linens, the beautiful food and the smells, the long spoons and all of the serving dishes, the same long spoons. He looks around the room full of people. These people are happy. They're full of life. They're smiling. And this is the difference. They're using the long spoons to feed each other. The takeaway here is that David wanted to make sure that we are reminded that through any crisis, sometimes the darkest of times, the one way that will get us through it is making sure we stay together. So this is how we'll get through this crisis. This will be no different. together lifting each other up. In this spirit, WellSpan is offering at no cost to you an evidence-based portal and app called My Strength. It will be offered during the crisis period of this pandemic for the next 6 months through October. It has been widely used by WellSpan Philhaven, our behavioral health entity, for years, and has now been shared throughout our own health system for our fellow team members and coworkers to help support them. While it's designed to support the psychological and emotional well-being of each one of us, it has evolved into a truly whole person well-being app. It's been proven to help reduce anxiety, depression for those who engage with the secure, confidential, personally tailored programs. It has specific resources for COVID-19. It's easy to use, it's backed by research, it can be converted to Spanish in one click. We will be providing all the participants today a one-page informational flyer on how to access My Strength and all the tremendous offerings it has for you. So remember, together, we will get through this.